Hello, Senior Stoner fans. It's the real Senior Stoner back at you for your Puffco Peak Pro and brand new recycler by Cream City Vapes. Let's give a shout out to Cream City Vapes for coming up with a really nice, inexpensive recycler for the Puffco Peak Pro. We're going to be using diamonds today. Hello, everybody. Thanks for joining me. As always, if you enjoyed today's video, you know what to do. I will confess that the last couple of videos were pre-recorded prior to my surgery that I had on Tuesday. Honestly, I would not have been able to do a video the last couple of days. Thank you all for joining me today as I continue my recovery. That is going to be the topic of the day. What I want to talk about is how you can do better post-surgically. One of the things we have to be aware of when going in for surgery, and I'm not talking about a procedure where you go in and get a couple of injections or something like that. I'm talking about open body surgery, which is what I had, robotically. You're frightened, you're apprehensive, you're scared, you might think you're going to die. Think of the horrible, and you're going in. When you come out, you've been anesthetized, you've been deeply anesthetized. It's different than a twilight when you go into a surgical center. You really are out for 3 hours, and it's a whole different regime getting you back to where you were. Getting you back to where you were is not just about healing the scars, slowing the physical pain with medicine. It's about dealing with what's called post-surgery depression. I did not even know it was an issue. I didn't know it until I started to experience it, so I started to look into it. What you need to think about the rooms of patients in a hospital recovering from surgery. They're filled with cards, flowers, and other gifts to cheer them up from loved ones and friends. Those gestures lift spirits, and the ordeal of undergoing surgery doesn't become bearable, but you smile. For some patients, however, the feeling of grief, anxiety, and despair persists after you get up from the surgery. The surgery, therefore, has taken a toll on the mental well-being. The phenomenon of depression after surgery is not uncommon, but it is not well understood. What we need to discuss are the symptoms so you know what you're dealing with. After surgery, the physical condition of a patient is very closely monitored while you're in the hospital. And somehow the emotional aspect of the recovery is overlooked. I had my surgery at 7:30. I was sent home at 2:30 in the afternoon the same day. Many of the times, patients are not aware that they're going to develop any kind of depression after surgery. It's overlooked and not even thought of. Doctors, nurses, relatives of patients undergoing surgery should be aware of symptoms of depression after surgery so that the condition, if it's picked up early, can be dealt with. Well, what if you're having a feeling of extreme tiredness and fatigue? It's normal after surgery. How about difficulty in sleeping? How about loss of appetite and maybe even weight loss? How about crying? How about thinking about hurting yourself because the pain is too great? Ideas about self-harm, anything you can do to reduce the pain. Loss of interest in daily activities, they hurt too much. And a low sense of morale and lack of motivation. These things are real. I can almost touch every one of them right now. The causes of the post-surgery depression have many theories of why they happen. Side effects to anesthesia is number one because it can manifest as depression. The medications they give us to put you deeply asleep like that really mess up and disturb brain chemistry and can lead to true depression. Well, how about uncontrolled or poorly controlled pain? Depression can be due to the side effects of the medications prescribed. Some painkillers lead to depression, and some can cause withdrawal symptoms very similar to depression. Upset stomach and digestive disturbances after surgery can lead to depression. And after any major surgery, the recovery can be long, and staying in bed or in home can be frustrating and depressing. Depression after surgery can be due to post-surgical trauma, PSTSS, just like post-traumatic stress syndrome. So there are a lot of factors that can lead this to happen, to the feeling of depression, feeling of despair, the anxiety or fear of developing a disability, inability to sleep, financial concerns, lack of control over your treatment, difficulty in communicating with healthcare professionals and family members. It all adds up to fear of one's mortality, and that is a game changer. It's the biggest trigger of post-surgical depression. How do you deal with it? Well, you got to move the body. Even if it hurts to move the body, you got to move. You got to exercise. You got to find a way to sleep regularly. You got to sleep during the night, and you got to sleep consistently. You got to stay connected with your friends and family. Feeling lonely can be very depressing, especially if you're recovering from surgery. So try to stay close to your loved ones, in touch somehow. Even if you're hospitalized, they cannot visit you. You can use the phone or other social medias to get in touch with them. Speak out. Do not keep your fears and anxieties to yourself. Talk to your family members. Talk to your friends about how you're feeling. And if you don't want to share it with them, get professional help. Try the best you can to be healthy. Try to take care of your physical and your mental health. Try to eat as best as you can. Try to stay away from the negative thoughts. They will pull you down. When you feel them coming, go the other way. Try to move it the other way. You see, recovering from surgery, unfortunately, can take time and involve discomfort. Many people feel encouraged that they're on the way to feeling better again. But sometimes this horrible thing called depression sets in. It's a complication of surgery. It's a serious condition. It needs attention, and you need to find treatment for yourself or for your loved one. You must understand that there are factors that contribute to the depression that have nothing to do with what you do. You might have had depression before surgery. What if you had chronic pain? What if it was a reaction to anesthesia? What if it's a reaction to pain medicine? What if you're thinking about your own mortality? What if it's just the physical and emotional stress of surgery, concerns about your recovery, anxiety about complications, guilt because you're depending on others, or concerns that the surgery might not have been enough? You see, certain surgeries carry a higher risk of post-operative depression, but it truly can appear after any operation. There is a true link between post-surgery depression and people who experience chronic pain. Post-surgery depression can also even be a predictor of pain that will follow. So it's up to all of us, for ourselves, for our health, for our futures, to try to grab a hold, try to understand what's happened, and push in the right direction. That's right, push in the right direction. All I'm saying is that when you see these symptoms coming on, you're not alone. When you see these symptoms coming on, you're not dying. When you see these symptoms coming on, you will be okay. When you see these symptoms coming on, you must remember that it's part of what happens, unfortunately, post-surgically. Let's take our dab of the day with our Cream City glass for our Puffco Peak Pro. Here we go. As always, if you enjoyed today's video about what happens after surgery sometimes, don't forget to subscribe to the Senior Stoner family, send a like, and comment. I reply to every one of them. Cheers, everybody. I'm toughing it out. Thanks for joining me today. Oh boy, that's very tasty. Totally different deal. Cream City, you come up with a really good thing. This is a totally different type of thing than the regular bubbler. Sounds different, tastes different, acts different. Excellent. Thanks for joining me, everybody. Have a great day. Cheers.